So we are here to address the issues of service delivery in this hospital. There has been a general outcry of service delivery in this hospital for the last close to 2-3 years. And in the last 1 or 2 weeks, there has been an incident where the community has had an outcry. So we would say that the issues have been there, but they have culminated on an incident. So I want to assure the public and the community that we are working very hard to make sure that this outcry has been there is resolved and there is a smooth service provision to the public. I want to say that there has been a myriad of challenges from human resource to, for example, this hospital. When the governor took over the office, she inherited a debt of 250 million from this hospital alone. That is undergoing audit, and some of the outcries that have been there is because of suppliers complaining they have not been paid since 2020. And therefore, I want to inform the public, because our role in doing that is that an audit is going on, the health sector audit, because we agreed with the audit team that was formed that they will do bit by bit. They will give us a report for the health sector on Friday, so that we see which debts that are payable and that are not payable, so that we do further investigation. 2017, not even a single doctor has been employed by the county, not even a single medic has been employed by the county, and therefore the hospital has been employing, and then therefore the money that is collected here has also been used to pay for service provision, to pay for salaries, which is not a practice, which is not a good practice, because Facility Improvement Fund is supposed to focus on service delivery and not employment. The board has a mandate of doing oversight. The board is drawn, ideally, if you look at the regulation, the board should be drawn from the community of residents or service provision. And therefore, that's why we had the governor promise that when she's reconstituting the boards, we are going to have boards constituted from people who reside within that community. Because apart from oversight, the other big role of the board is to make sure they understand the issues in the community, and they come and have a dialogue with the management, and therefore they address them. So for these incidents to have happened, whereby it went on for several days, there was an outcry in the community. We feel that the board also failed in its mandate, being the mediator between the community and the hospital. So emanating from that incident today, the governor has decided to dissolve the board of the hospital. A new board will be gazetted in the course of the week, so that they take up that role better of making sure that they are the ambassadors of the community in the hospital. Because the role of the board is nothing else, apart from oversight, is to be the ambassador of the community in the hospital, and also to be the ambassador of the hospital in the community. So a new board will be formed. That's the message from the governor. And that board will be constituted from the community of residents, and that is Naivaisha. And that board will have a mandate of make sure that they do a lot of public participation, they do a lot of civic education on what is going on in the hospital, on the service we are providing, but also they must establish a feedback mechanism with the community. As pertaining to these particular incidents, we are doing investigations. And that's why we have only talked about the board. As to the, for the clinical procedures, we need to do a very thorough investigation. The team is already doing that. We have a preliminary report, but we want a final report, so that whichever action we take, you realize for civil servant, we have various levels of governance. There are the labor laws, which we must follow if it's disciplinary. It's an issue of skill and communication. We'll do additional training, because probably there's a challenge of skills. If it's an issue of communication within the organization, we'll improve on that. But when we get that report, we will take actions that are commensurate with the incidents that we have in hand. So depending on what the report will tell us, we could call the medical board to assist if there is professional negligence, so that action is taken on the officers. If it's not that, if that is done, we'll also go further and do other administrative action that needs to be done in terms of discipline, but that is with a caution. It will depend on the outcome of the investigation that we are doing. Yeah, we have had that challenge of drugs running away for several years. When the governor came in, the first action was to buy drugs, worth about 48 million. But we realize for hospitals that are not drugs for a year plus, it was a drop in the ocean. So those drugs have sustained us to this level. We are in the process of ordering the second consignment, which is about 100 million. That should be delivered in the course of this month. And therefore, if we have a few challenges here and there, we will be able to address them. However, for hospitals, why not for that huge wage bill that we need to address? And that's why we are saying we need to address the governance within our hospitals. Hospitals has the Facility Improvement Fund. And therefore, a hospital that is getting a small fee from service provision should not have a challenge with supplies. We don't have enough healthcare providers in our health facilities, And you realize that's one of the big, healthcare, the most important aspect of healthcare is the service provider. Because even counseling or even preventive health services are health services. You can't do it without a healthcare provider. So I have to say that we have a huge shortage, and that is why hospitals maybe felt vulnerable and they started employing healthcare workers. One of the things we need to address is not just the numbers, it's the attitude of staff, because I think there's been a laxity in supervision, and therefore we also need to talk to our staff, we need to motivate them. You realize there's a big outcry about promotions. Some of them are saying they have never been promoted since, I think, 2015. And that agenda is on the table. Promotions will be done this month and next month. The governor has authorized the board to start looking at how they could look into that. The governor has asked the Department of Finance to start looking for finances so that at the right time, the promotions will be done. So that even those who are there, even as we address the shortage, they are motivated to work.
Na kwa hakika tunataka kuamini ya kwamba vile ambavyo tumejadiliana kwamba tutatatua hii kesi na itakuwa kwa uwazi. Hakuna mapendeleo kwa pande zote, na kwamba hatua zitachukuliwa kwa ambao watapatikana wamefanya makosa. Ile kitu nataka kuambia wananchi ni kwamba tulieni na tunafanya kila juhudi kuhakikisha kwamba hii mambo haitaenda vile watu walikuwa wanafikiria, lakini itafanyika kwa haki na kwa usawa. Kwa hivyo